If my best friend came to me and said, Beth, I need to find a trauma therapist, what should I look for? As a trauma therapist for over 25 years, I would have some very specific criteria to share with her. And I would want her to look for certain things that I'm also going to share with you today. Because if you have finally decided to go to therapy, or that you want to address your trauma or your anxiety or your childhood wounds or your abuse or your betrayal or your painful life experiences, I want to tell you something really important. Not every therapist is the right therapist for trauma work, or not every trauma therapist is the right fit for you. And that does not mean that any of those therapists are bad. In fact, it just means that trauma healing is a very specific set of skills. And that's really important, because here's what often happens. Either you hire a therapist that says that they're trauma informed, but they're really not capable of helping you with the particular type of trauma that you have or the intensity of the work that you have. Or you actually start working with them, you feel understood, you feel seen and heard, they're doing a good job building insight with you, but nonetheless, you are still getting triggered, repeating patterns, feeling anxious, feeling emotionally overwhelmed, feeling disconnected from yourself, even after months or years of doing that work with them. And it may be a sign that the right trauma tools have not really been used with you. So you may start wondering, maybe therapy just doesn't work for me, or this is just the best that I can be. But often the issue isn't therapy. It's about finding the right therapist with the right skill set and this criteria that we're going to talk about today. So today we are talking about, if I were looking for a trauma therapist or my best friend was, here's exactly what I would look for. Welcome back to the Holistic Therapy Revolution. I am Beth Miller. I am a holistic therapist for over 25 years. I'm also the creator of the Advanced Holistic Counseling and Coaching Model. In addition to working directly with clients and also running a group practice, I also train therapists and healers and doctors in the model that I created that integrates the most effective psychotherapeutic tools with the most efficient and effective holistic modalities. And together, what that provides is whole being healing for clients and also for ourselves. So if you'd like to learn more about that, you can check out the certification link below. So here's my criteria. Number one, look for someone who does trauma treatment, not just trauma-informed therapy. So let me explain this really carefully. There are many wonderful therapists that are trauma-informed. Trauma-informed is a perspective. It's a lens. And that lens is saying, I need to be sensitive to the possibility that this person has trauma in their background, and that I should be aware that that is a possibility. And that sensitivity is going to mean that I'm going to do some things and I'm not going to do other things. There are other groups that are also trauma-informed or that are becoming more trauma-informed, like dentists, doctors, orthodontists, gynecologists, because we want as many practitioners as possible to be aware that the person in front of them may have a trauma background that is going to impact how they experience whatever work that is happening in that appointment. For example, dentists should become trauma-informed because many trauma survivors that have sexual abuse backgrounds find going to the dentist to be incredibly triggering. Now, a lot of people don't like the dentist, but this is different. This is about the client is very often laying down, they're in a powerless position, there's very often a person in authority, which is typically a dentist, standing over them, and the client often has their mouth open and may even be unconscious. These are triggers for clients that have sexual abuse backgrounds. And so a dentist that is trauma informed might try to make sure that they do things in a particular way to lessen those triggers for a client. That makes sense. Trauma informed therapists also have a lens or an awareness about what might have happened to clients, but that is different from trauma therapy. So trauma informed work says, what happened to you, being willing to ask the questions or to have sensitivity around the possibilities of trauma in a person's background. Trauma therapy says, I know how to work with this and to treat this and help it to heal. And those are really two very different things, although the average client really doesn't know the difference. They just see trauma informed written on somebody's Psychology Today profile, and that might cause them to think this person knows how to actually treat my trauma. And so we want to be really clear about that. So trauma treatment usually means that the therapist has additional training and experience in actively helping people to process and resolve the trauma itself. And that's very important. So instead of saying, I just understand your trauma or I'm sensitive to it, they may also say things like, I use EMDR, I use IFS, internal family systems, I use somatic work, I specialize in trauma treatment, and that trauma treatment is an actual specialized set of skills. Second thing that I would want my best friend to look for if she was looking to hire a trauma therapist. Ask the therapist whether they have experience with the type of trauma or challenge that you have. So trauma is not a one-size-fits-all. As a matter of fact, it's a phrase that has expanded in meaning. Now it has many different items under it versus just severe trauma like the past. And so examples may include childhood neglect versus sexual abuse versus emotional abuse versus war experiences versus natural disasters versus racism versus homophobia versus religious trauma, abusive relationships, having a mentally ill parent, betrayal trauma, grief and loss. So you can see that there's so many different types, and that wasn't even an exhaustive list of the different types of trauma that people can experience. So it's important that you look for a therapist that has experience in the types of trauma you have experienced. Now, it is not always important for the therapist to have experience with all of the types of trauma, but they have to have an understanding of how those things might have impacted you developmentally, emotionally, how it might have affected your brain and your physical body, and what kinds of tools are going to be most effective in helping you to relieve those. So you might ask the therapist, have you worked with clients that have experiences similar to mine? Now, it is important that they understand the common patterns, the common nervous system responses, the common triggers, the common healing barriers, and what modalities are going to be most effective. Because different wounds can create very different experiences for people. Third criteria. This is such an important one. I hope you will lean in here. Find someone who can go to the difficult places with you without personally becoming overwhelmed. Now, this is a hard one to screen for in the beginning unless you actually directly ask the therapist. So trauma work often involves very painful material, right? And your therapist should be able to handle that material. They should be able to emotionally handle it and physically and mentally handle it. In other words, the therapist needs to be able to stay grounded, calm, provide emotional steadiness, safety, and what we call detached compassion. That's where the therapist is incredibly compassionate and emotionally available, but is detached from the outcome. And that space, that detachment, provides just enough safety for the therapist to be able to witness and help you walk through your trauma without becoming traumatized themselves. Now, this is an actual skill that trauma therapists have to learn. And if you don't have it, it's important that you not do trauma therapy until you know more about how to actually conduct detached compassion and also being able to handle the things that the client is saying. So I'm going to give you an example of this. I had a client years ago who had very severe sexual abuse trauma. And when she hired me and we started working together, she told me about maybe a month or two deep that she had been testing me for a couple of months. And I was curious, so I asked about it. And she said, I've been testing you because I've had several therapists before you, and I could see that they could not handle my stuff. So I asked more about it. What do you mean? Well, the previous therapist that she had worked with had either started crying during session or had had a look that said that they were either startled, overwhelmed, or being emotionally impacted by what she was sharing. The problem with that for her is that it would then ignite or elicit a part of her that felt like she needed to take care of the therapist, which is very common for clients. Clients have often learned through many experiences that they have to take care of the people that they tell about their trauma. And that may have happened even in their childhood, where perhaps they shared their trauma with their mom or with somebody else. And then that person became overwhelmed, emotionally dysregulated, heavily impacted. And now the client has had to take care of them or try to fix that for them. So clients need to know that you can handle their stuff. This is an even more important reason why therapists should not work with issues that they cannot handle. There are issues that are too much for some of us. There are issues that are too triggering. Perhaps you're not triggered by sexual abuse, but you're triggered by hoarding. Perhaps you're not triggered by neglect, but you're personally triggered by a natural disaster. There's something that happens in you in your own countertransference. Now, it's important to know yourself as a therapist in order to decide what issues you can work with and actually provide that steady, grounded presence that is safe for the client to be able to share all of their stuff without, as my client puts it, without actually destroying you. The client wanted to make sure she wasn't going to destroy me and that I could handle her before she shared the depths of what had happened in her life. The other part of making sure that you work with a therapist that is not afraid to go there is that therapists sometimes collude with their clients. I know, I wish we didn't, but we do this sometimes. What happens is that the therapist doesn't want to activate the client, or they know if they activate them, they may not know how to actually help the client to regulate and button up or contain that trauma before leaving the session. So what some therapists do is they don't go there. They don't ask the difficult questions. They don't ask much about the trauma. They start not asking about the trauma or not connecting the dots or not eliciting responses or not asking the difficult questions because they are concerned about either being able to contain the trauma and the intensity once it opens up and they don't know what to do with it, or they're not sure if they want to deal with that discomfort themselves. Now, remember, therapists are human, and so avoidance can be built into us too. Here's the thing. You want to make sure that your therapist is going to ask you the difficult questions at a pacing that makes sense to you. So here's my suggestion. I suggest you ask directly. Say, listen, I'm really just trying to make sure I do my due diligence. Do you feel like you can handle really difficult information related to this traumatic topic? And also, can we make an agreement that we will actually deal with the difficult things and not avoid them? Because I might want to avoid them and I can't have you avoiding them too. And what you're looking for is a co-creation with the therapist where they say, absolutely, I'm on that team and I can do that with you. Here's the fourth criteria to look for when hiring a trauma therapist is to find out what modalities they're going to use in order to help you. So trauma is different than the everyday average therapy session. Trauma is a specific category of types of challenges that the client is bringing to the table in their history, and the therapist needs to have the appropriate modalities that help the most with that trauma work versus developing just insight or doing processing work. So it's okay for you to ask the therapist what kind of modalities they use. I would absolutely ask this question. What approaches do you use to help trauma heal? Because trauma needs more than insight, and insight can be incredibly valuable, but many people already understand why they struggle, or they've been able to sort of make the connections between their life experiences, and they need more. They need a type of resolution and relief that they've never had. And so when they're looking for that, some of the modalities that have strong empirical or research support behind them are, of course, EMDR to help the brain to reprocess the traumatic memories, EFT tapping to help regulate emotional activation and also shifting core beliefs about the self that have been developed through that trauma, IFS that heals wounded inner parts, breath work to help regulate the nervous system and trauma and actually to release it from the physical body, somatic approaches that help to address trauma that is held physically in the body, meditation and mindfulness, because it helps to build awareness and emotion regulation. Now, here's a caveat that I have, and I might get some hate mail about this. I recognize that could happen, but I have to say this because if you're looking for a trauma therapist, it's more important that we look out for you than the therapist when it comes to this one. EMDR is a really powerful tool, but if someone has severe, highly complex trauma, PTSD, or their trauma is intense, it is important that you work with somebody that has substantial experience using EMDR. Now, there's a lot of new therapists that have recently become trained in EMDR, and that's a beautiful, wonderful thing. We want that. The thing is, when we're working with more intense trauma, it's important that the therapist be somebody that has extensive experience using EMDR and using EMDR with that type of trauma. If we don't have that, we run the risk of two things. One, that the therapist is actually overwhelmed and unable to be able to do the work safely because they don't really know the power of what's going to happen in that EMDR session with the intensity that can happen and also the emotionality that can happen. So we're wanting an experienced therapist, experience in EMDR, and experience using EMDR on your type of trauma, right? Two, for any therapists that don't have as much experience using EMDR, not to worry. Use EMDR, but on less intense issues. Use it on things that don't have as much intensity in them and aren't as complex so that it feels successful for you and not overwhelming for you, and so that it's really effective for the client as well. Everybody starts somewhere, and newer therapists absolutely need experience to grow. That experience should be a building experience and always with really good supervision to make sure that you're doing the work in a way that's safe for you as the therapist and that doesn't overwhelm you and make you leave the profession, but also is really effective for the client. Now, here's the next criteria, and this is really personal to me, and maybe this wouldn't apply to you, but I personally would look for somebody who is very holistically minded. This part does reflect my own philosophy because I believe holistic therapy and holistic trauma therapy is more effective than non-holistic therapy and non-holistic trauma therapy. Trauma affects all of the aspects of our being, our thoughts, our emotions, our behaviors, our nervous system, our physical health, our relationships, our beliefs about ourselves, our spirituality, our identity, our understanding of our relationship with the world and the greater universe included. So I personally value therapists who understand the whole person. So that might mean that I'm looking for a therapist that knows how to do energy work or somatic work with me or meditation or incorporate spirituality, incorporate chakra work, incorporate things like functional nutrition and functional fitness, nervous system regulation. I want all of those things because I know my whole being has been impacted by my experiences. So I want the solutions to involve my whole being as well. I want to move beyond let's understand what happened to let's deeply heal your system. And then, of course, there's the practical realities. These are kind of a bummer because we all have to deal with the practical aspects of finding a therapist, meaning the best therapist is not helpful if the treatment is financially impossible. So you're either looking for somebody that's a trauma therapist that has all of the other criteria that we just talked about that is in your insurance plan, or that you are able to use out-of-network benefits with, or that you can afford paying their rate. Now, I will say that it is true that very often more experienced therapists no longer take insurance. And this is because A, insurance is so difficult to deal with and very often does not pay well at all, but also because the therapist wants to provide a higher level of care than what that insurance is actually going to reimburse for. But therapy has to be sustainable. So if you can hire somebody that is a self-pay therapist and you can make that choice, then that makes sense. If you cannot, I have some suggestions. You're either looking for a therapist that's covered by your insurance or one that you pay for the sessions and the sessions are reimbursed to you once you meet your out-of-network reimbursement, or you go to a community agency that provides trauma or victim services. So every county has some kind of victims information bureau, domestic violence center, etc. Look for the one in your county and find out if they have free or low cost trauma therapy, because they may have something that is available to you that will cost you little to nothing. I used to work in one of those agencies for the first 7 years of my career. It was an incredible experience. We provided the highest level of trauma therapy for free. So I hope you'll be able to find something like that too. And lastly, this should go without saying, but look for someone that's kind. Look for someone who's non-judgmental. Look for someone who's organized. Look for someone who's effective. Look for someone that doesn't talk about themselves. Look for someone who makes you their main priority when you're in session. And look for somebody that is truly going to create a platform and a space for you to be able to do this really, really good and important work. So finally, if I could leave you with one message, it would be this. Don't be afraid to ask therapists these questions. And it's true, sometimes therapists are a little prickly about having to answer some of these questions, but just tell them, I don't want to waste your time. I don't want to waste my time. I want to make sure I find somebody that is the right fit. Would you mind if I asked you a couple of questions to help me establish whether we might be a good fit? And most therapists should be able to handle that conversation because it benefits them as well to make sure that the two of you guys are a good fit. So questions are allowed, curiosity is allowed. Finding the right therapist can become a game-changing part of the trajectory of the rest of your life. And that is really, really important. So thank you so much for being here on the Holistic Therapy Revolution. If you're a therapist, coach, healer, or doctor, and you're interested in learning how to integrate the most effective modalities from both psychotherapy and holistic healing, please check out the link below. And thank you so much for all of your curiosity and for being here with me today as we expand what it means to align when talk is not enough.